a seizure, it depends on the type of seizure the patient is having. If a patient is having a generalized tonic-clonic seizure, you'd want to remain calm. Seizures are very frightening things to witness, especially if it's the first time you're seeing the seizure. You'd want to remain calm and stay with the patient. If a patient has a generalized tonic-clonic seizure, they would have fallen to the ground. So you'd want to lay the patient down with something cushioning the head. You'd want to put them on their side. And when you do that, the tongue comes forward and any saliva in the mouth also comes forward, and they won't choke on their saliva, and they won't, the tongue won't go back and block their breathing passage. If they have any tight clothing, you'd want to loosen that. Any neckties, any belts around the waist, you'd want to loosen that. And if they are in any harm, any objects around that they may jerk and may harm them, you'd want to remove those objects. You'd want to stay with the patient, and you'd not want to give the patient anything to eat or drink until the patient has recovered full consciousness. We wouldn't want to go doing things like blocking the patient's airway by putting anything over the nose. And one thing that you shouldn't do is to try to put anything in the mouth to hold the tongue down. There's this misconception that sometimes during a seizure you may bite your tongue and swallow your tongue or choke on your tongue. And so in the past we used to use a tongue depressor to hold the tongue down, but that's no longer necessary. Once you put the patient on the side, the tongue usually will come forward, and the saliva also will come forward, and that opens the patient's airway. You can cause a lot of harm if you try to get anything in the mouth, because usually the jaw is clenched tightly closed, and you're unable to overcome that force trying to open the mouth. And sometimes you can do harm like breaking off teeth, or the patient might bite on your finger if your finger is what you're using, or bite on a tongue depressor, and they may choke on the tooth that's broken off or on the bit of tongue depressor that's broken. So it's very harmful to try to put anything in the patient's mouth if they're having a generalized tonic-clonic seizure. Most seizures of those most generalized tonic-clonic seizure will stop within about 5 minutes. But if the patient is having a seizure going on for 5 or more minutes, you want to get that patient some help taking them to the hospital. And once they've come around, then and they're no longer confused and they're conscious, then you can offer them something to drink. If a patient is having a focal seizure in which they're walking around confused and behaving in an unusual way, you don't want to try to rush the patient or restrain the patient, because they in turn will become combative. You just stay with the patient, make sure they don't do themselves any harm, and they usually will come out of these seizures in a number of minutes and be back to normal.